Welcome to Women in Healthcare Leadership podcast series brought to you by Medscape Education. Our goal is to provide a platform where we can educate, advocate, and inspire women leaders to lift as they rise. With every episode, you'll hear from her as we showcase the perspectives, insights, and experiences of women who are leading the way in advancing women's health and empowering the next generation of women in healthcare.
Welcome to today's episode in Season 2 of our Women in Healthcare Leadership series, which I'm delighted to say has recently been honoured with a gold at the 2024 AVA Digital Awards. My name is Victoria Harvey-Jones and I'm Associate Director of Clinical Strategy at Medscape Oncology Global. I'm also privileged to be leading the Patient Centricity and Integration Initiative here at Medscape, where we're championing the inclusion of the patient voice in our independent education for healthcare professionals. Starting at education planning through to execution, thereby giving expert patients and global patient advocacy groups an important seat at the table to ensure that our education is as impactful as possible for our learners and ultimately the patients and their families who we all serve. It is through this Patient Centricity Initiative that I came to work alongside the two incredible women who I'm honoured to be talking with today. Lorna Warwick, CEO of the Lymphoma Coalition, who is based in Toronto, Canada. I've had the pleasure of working with Lorna over the last 12 months, including co-authoring a white paper that we developed together, exploring how we can close the gaps in patient centricity in cancer care. And please do take a look at the link in the show notes. She's also participated on some of the HCP education that we've developed in lymphoma and chronic lymphocytic leukemia, and we're delighted to be partnering with Lorna and the Lymphoma Coalition on programs related to the upcoming European Hematology Association meeting later this year. So welcome, Lorna. Thanks so much for joining us.
Well, thank you, Victoria. I'm very happy to be here.
Also with us is Anne-Marie Baird, a Senior Research Fellow at Trinity College in Dublin, Ireland, and President of Lung Cancer Europe. Anne-Marie and other members of the Lung Cancer Europe have been involved on several of our activities focused on lung cancer over the last year. Anne-Marie is also a key member of the steering committee on our largest learning curriculum in lung cancer, where she's helping to shape the direction of our education to ensure that the patient voice is represented throughout. So welcome, Anne-Marie, and thanks so much for being with us today.
Thank you, Victoria. Really looking forward to it.
And today we're going to go on an inspirational journey with Lorna and Anne-Marie and really explore how they got into patient advocacy, their rise to becoming female leaders, the challenges they faced along the way, and how they overcame them. And they also share advice and the keys behind their success. So let's get started. So Lorna, Anne-Marie, it'd be great just to start off if you could please give the listeners some background to the patient advocacy groups that you lead. So Lorna, perhaps we could start with yourself.
So I'm the CEO of Lymphoma Coalition. Lymphoma Coalition is a global network of patient advocacy organizations, currently sitting at about 90 organizations in 55 countries. And each of those organizations provides some support of some kind to patients with lymphoma to ensure that they are getting the information they need, that they have good access to support systems, to make their experience as easy as it potentially can be. And from a coalition perspective, our role is really helping provide good, solid information. Not everybody has access to the best doctors, for instance. So how do we make sure that we're getting that information to them? We do advocacy to get access to the best care, and also helping our member organizations so they can advocate themselves. And then, of course, we do some best practice sharing. So if somebody is doing something amazing in Australia, can somebody in France replicate it, and what would that entail? So those are basic components of kind of the work we do. And of course, that patient experience is really important, and how we include that in all of our planning and the work that we do. And to do that, we do a global patient survey every 2 years on patient experience. The 2024 edition is live right now. And then we actually packaged that with some qualitative interviewing as well, different focus groups with patients and caregivers to explore some of those topics more in depth.
Thank you, Laura. And over to you, Anne-Marie.
Well, it's great to hear all of the different stuff that Lorna's organisation is doing, and a lot of it overlaps really with what we're trying to achieve in Lung Cancer Europe. So Lung Cancer Europe is also known as Lucha, and really our mission is to be the voice of Europeans impacted by lung cancer. And when we say that, we mean not just only those diagnosed with the disease, but also their families, caregivers, and anyone really within the lung cancer community itself. And our goal is to really collaborate with our members and stakeholders to ensure people impacted by lung cancer have the care that they need to achieve the best possible outcomes. And really, our core purpose falls into 4 main areas, and that's to represent. So to represent the common interest of the European lung cancer patient community, to strengthen, because we know there needs to be strength in the voice of the community in order to achieve changes for the better within the community. So we want to strengthen that voice across Europe, and we want to address common problems within our community by mobilising people and leading collective action by our members and other stakeholders as well. And of course, really important when you have those together to amplify the voice of the community as well. And again, a lot of that is done through collaboration. And by bringing those 4 core purposes together, it's really to then create the power and to drive that power to improve the lives of people affected by lung cancer in Europe and further afield. In terms of representation, we've over 40 members in over 20 European countries, and that's growing all of the time. So really, our goal is to try and bring everyone together for collective action.
Wow. Thank you so much, both. I just sit here in awe of, everything that you've just said and everything that, you're trying to drive through your respective organisations. But, let's think, now just to move more towards your personal journeys, to within or to reaching the organisations and the positions that you both held now. So what drove you to become involved with patient advocacy, and through this, what is your personal mission, if you will? Lorna, perhaps you could start.
Unlike a lot of people that are in advocacy, I have no direct connection to lymphomas, and which is always interesting, where people are like, how can you be a really good voice for the patient or the caregiver community when you don't have that direct connection? But what I do have is some really good experience working in nonprofit through the years. And I also am really good at looking at that data and having conversations with people and seeing overall what are the issues and how can we address them, and perhaps in a different way. And my personal journey really into advocacy partially was accidental, but I grew up in a family that always volunteered. And so, my parents would have us out building playgrounds or cooking for people or wrapping gifts at Christmas. Like, we were always involved with different volunteering opportunities. And I think that kind of stuck in my head. And when I went to school, originally, I thought I would teach. And when I got out of university, there weren't a lot of teaching jobs. And I started teaching through the Salvation Army, very practical skills in some cases to obviously marginalized communities. And from there, I found that it really resonated, and I stayed in kind of like poverty relief organizations for a while. And then I moved into health, starting with diabetes, and then eventually got into what was the Leukemia and Lymphoma Society of Canada. And even though I had moved around a bit before that, once I got into the blood cancer space, I found a really good fit for me personally. One, I like to learn and I like new things. And there's been so much activity in this space that it does provide me a lot of opportunities to keep looking like, oh my gosh, now this is happening. What are we going to do with this? And how do we elevate this and make sure that our patient needs are still addressed in something where we don't really even know what's going to happen with this therapy because it's so new into the cancer world. And so that has been really impactful for me and helpful to keep me kind of focused on the topics. But I've also met some amazing people. And I try, all the time when I'm listening to these stories is like, what would I do in that situation? And it sounds, kind of, I don't want to minimize people's experience, but one of the things that happens with a lot of blood cancers, and when we're looking now into the lymphoma space, is people are really fatigued to the point that their life doesn't continue the way it used to. I had one woman phrase it to me this way, that she mourns for her former life because now she feels like an observer sitting on the outside watching rather than fully participating. And I have a lot of energy. And, for me, I was always challenged, like, how would I feel if I couldn't do the things that I like to do? And it's through those conversations with people that, combined with the fact that there's so much activity in this space, that has really kept me committed into the blood cancer world. So it's a space I've been in for more than 20 years now. And I've been with Lymphoma Coalition since the very end of 2017. And the one thing that Lymphoma Coalition does that, again, matches well with my personality is just the way that we do a lot of work looking at data. I like data, and I know not everybody does, and you don't have to. It's fine.
I'm with you, Lorna.
I love data. And so, being able to analyze that and read stories into that and communicating that back to different stakeholders that need to hear it, whether that be pharma when they're doing their own drug development activity, it's research groups, it's doctors. How do we change practical things in clinic so that we can make the patient experience better? And when you have the data backing it up, it's so much easier to convince people that this isn't just something we've heard. It's just not something I feel. But look, I have data, just like you have data on the efficacy of this medication. I have data on what this means to a patient and how they experience it. Let's figure out how to close those things so we can give the patient the best experience.
Oh, thank you, Lorna. And I know as the next phase or part of this conversation, we're really going to dig deeper into that data, the power of that data. And I'm sat in here excited like you, and I think that's one of the really exciting things, through working with both of you and the movement, in patient advocacy. Is the collection of data, the collection of the patient-reported outcomes, and then the impact that can have to inform sort of so many ways. So thank you, Lorna, for sort of sharing that, what's really drove you and continues to drive you on a daily basis. As I said, I told everyone this is going to be an inspiring journey and conversation. So look, Anne-Marie, over to you, please, and sort of same question about what drives you and what's your personal mission.
Well, I guess before I should start, I should say to Lorna, irrespective of how any of us end up in advocacy, whether it's personal link or otherwise, once you have a common goal, and that common goal is for the good of the population that you're trying to represent, I think all is that to be welcomed and not ever apologized for. And you're doing amazing work, so kudos to you and to your organization. For me, I guess it was a personal experience. Both my grandmother and my aunt died from lung cancer. And although when my grandmother passed away, I didn't know what advocacy was. I had no idea. But when my aunt passed away, I was in the middle of my PhD, which was in lung cancer. And obviously then I had a much better understanding of what this meant, what that impact was going to be, not only on my aunt, but my family. And on the day she was diagnosed was my first experience of lung cancer stigma. The question of, oh, well, did she smoke? Oh, well, then, why are you surprised? Why are you upset? And what really got me was that disconnect and that lack of empathy, because irrespective of what a cancer diagnosis is, it's a tough diagnosis. It's tough on the person. It's tough on the family. And then I think when, people want to judge or look at it in slightly different ways, that is just really, really, really hard, because in a way, you kind of start questioning yourself, and it really just makes a very hard situation even harder, if that makes sense. But I'm not great sometimes, or at least I wasn't. I'm getting better at putting my hand up and saying, well, I'm going to use my voice to make a difference. It did take me a little bit of time following that experience to really get into advocacy properly. And you're going to hate that I use the term luck, but then it was a bit of luck that really brought me into advocacy properly. I got involved through lung cancer social media on what was Twitter. And then I went off to Australia, a great Australian adventure for research, and got more involved in advocacy there. And that really helped me find my own voice to become more involved in advocacy. And I then brought that back to Ireland. And then I think once you get into this field, one thing leads to another. It's just like any other kind of network. I became aware of Lung Cancer Europe, and I was like, oh, if there's anything I can do, I'd really love to help out. I was an ambassador for about a year. Then I got elected to the board, and I was on the board for 2 years. And then I got elected as president. And I got elected as president in 2020. So obviously then when you go into a pan-European organization, that network, that community, all of those amazing people you get to know further expands. So I guess my journey started with the stigma, but then there was that bit of a pause because I was like, oh, can I do something? How would I do anything? To then really having people around me that helped and encouraged me to find my voice and get really involved in advocacy. And in terms of my mission, my mission, I feel, is to try and translate what's going on, what people are saying about their personal experiences, the issues that they're facing, and to try and translate that in such a way that it's going to have the biggest impact. So whether it's patient-driven research, whether it's talking to different stakeholders, whether it's talking to policymakers, whatever it might be, I see my mission and advocacy as being that bridge, because I don't live with lung cancer. Yes, I've had the experience through my family, but I, as an individual, don't have it. So really, it's to try and listen, to try and translate, and to try and amplify the voice as best as I can, if that makes sense. And it also always comes back to data, like you both have said already. As a scientist, data is the big thing. And in advocacy, data is also a big thing, and people tend to forget that. But sometimes it can be difficult to translate that data. So that's where the bridging comes in as well.
No, thank you, Anne-Marie. And I always have that at my mind. And again, at the heart of the initiative that I'm driving, you've both been involved, is, how we can best represent that global patient voice in our education, but being mindful and remembering that every patient or person living with lung cancer or lymphoma, are an individual with their own different, challenges, needs, etc. And I think that's really, key to understand. But thank you both so much for sort of sharing, why you got in that sort of journey, very different journeys there, but all, both with the same mission shared here about making a difference and to people's lives, and being that voice, being that bridge. So look, let's talk now about, I guess, you are both sitting, Lorna, CEO, Anne-Marie, the president. Let's talk about now, your path to becoming female leaders. That's at the heart of this, podcast as well, to help inspire our sort of, listeners as well, and to sort of share that journey. So I'd love for you both now just to, talk a little bit about, that path to becoming female leaders, what challenges perhaps you've faced along, that journey in patient advocacy, and, how you've overcome them. So back to you, Lorna.
It's an interesting field to be in. Because everybody comes really into patient advocacy with a lot of passion. And so when you're talking to people outside of the field, they often think that, everybody's, coming together for a common good. And so there's going to be a lot of positivity and everybody supporting each other naturally. And instead, it's not necessarily like that, because people come in with a lot of passion for fixing the issue that they saw or they see in the healthcare spectrum. And when you have a group of people on your board or within your organization, or a vast number of members like we do, they don't all have the same ideas on what that big issue is. So, getting everybody on side can be quite difficult. And so when you're navigating through a pathway of growing within advocacy, it can be quite difficult. And, there are some important lessons for me, at least along the way, is one, never take anything personally. And I know that's a really hard one, but people come in with so much passion and so much determination that, sometimes that may come across in a very harsh, or perhaps may sound negative, and it's really not. It's just them really focused on this issue because of what it has meant to them and their own personal experiences. And so I will say just up front, it's like that was a big lesson for me, and something that I often communicate to others. This is not personal. Let's look at what the issue is behind something and see how we can navigate through this. My journey, though, when I look back over how I ended up where I am, I never had that burning desire to be a CEO. So, some people, they look at their career path and they're just like, I want this title at some point. That was not me. It still surprises me sometimes that I have the title. But I do know certain things about myself. I'm a natural leader, as in if there's a group and we can't figure out where we want to go for dinner, I can take it for so long. And then I'm like, nope, this is what we're doing. Like I naturally step into that role. So, I have grown within that in the different roles that I've had within patient organization groups that I've worked with. But two, I'm always looking for something that challenges me. So, my next step may not have necessarily been about a bigger title, but it's like, how can I do more? How can I really struggled with this particular situation that faced me in this role because I didn't have the power to make the decision. So how do I change that when I'm looking at my next role? And so really that's how this progressed more than anything else. But I've also had really good people around me that have recognized something and have also helped push me and encourage me and support me to get to that next role. So, having those good mentors and supporters along the way has also been hugely helpful. From a challenging perspective, besides the fact that there's a lot of passion within the community, I will say as well, there's a general, in some cases, there's still this general feeling on what patient organizations are, and some people don't necessarily think that it's a professional organization. They still think of patient organizations, a group of people sitting around a kitchen table and figuring out how to bring some cookies into the cancer clinic or some biscuits or something. And it's like, how do we raise the profile of our profession in a way that we get to sit at those important tables and have those really good discussions that are leading to improved care? Not that biscuits or cookies are not important, because sometimes they are, but it's like all those other things that are happening. How do we make sure we're part of those conversations? Getting over some of those people that still have that kind of old-fashioned view of patient advocacy can still be a challenge, and is. So for people out there, still happening. It's not something that just because we do all this amazing work, everybody gives us credit for that and automatically invites us. But we have seen progression over the years. Even the time that I've been CEO, which is I got this role in 2019, we've seen some significant advances. For some of that, there's been some change in the community for sure. And when you have groups like the FDA or EMA saying that you have to include the patient voice in certain initiatives, definitely that helps. But still, even with that, a few years ago, there was more tokenism. Like, yes, we invited you. You gave your opinion. We didn't really listen or include anything, but we gave you a voice. Whereas now it's really more integrated. But a lot of that is us proving along the way that we know what we're talking about, We have evidence to back ourselves up. We're very professional in how we present ourselves. We're not afraid to voice what's really important to the patients, even if it's going against what others in the room are saying. But again, always backing that up. And I think those things definitely help elevate and get through some of those challenges that we face. And I will say this last thing, from a patient organization advocacy group perspective, by nature, there's a lot of females in the profession. So, unlike other industries where they may be male dominated and you're really fighting to get a role, there's lots of jobs where there are females in the roles in patient organizations. But as you rise up, more males come in, and it doesn't match really the percentages of females doing all the other jobs in the industry as when we're looking at the CEO role. And so there is some of that still where it's like a little bit fighting through with perhaps a different mindset or a different understanding of who should be running an organization. And you still do run into some people who assume that it should, males are more determined or something, or I really don't understand, actually. I'll be very honest. But, they think that it has to be a traditional male role. And obviously in our industry, there's lots of room for females who are very, very good at promoting what's important within their organization and raising the voice of a patient in a very real and credible way.
Wow, Lorna, thank you for just sharing all of those. I'm nodding away. I know that our listeners can't see that, but Anne-Marie and I are nodding away. And there's so many beautiful insights that you shared there, and so much that's resonating with, I guess, me and where we're trying to champion our education at Medscape as well. Really, not just involving the patient right at the end, as you were saying there. Now it's really bringing them involved, having a seat at the table, as I said, and, it's happening in pharma, it's happening in education in so many ways. You talked about mentors as well there, which I think is so powerful, and we'll touch on that. But look, Anne-Marie, please, now your sort of same questions, same perspectives, really, from your world in lung cancer advocacy, please.
Well, oh my goodness, how to follow that, Lorna, I guess, is my question, because you covered so many things. And like you, Victoria, I'm sitting here nodding and writing notes, and I'm like, oh my goodness, yes, absolutely. So this is a learning experience for me on this podcast today as well. But I guess for me, my path, there was definitely never any plan or anything, which I know everyone always says you're meant to have a plan, and obviously plans have their place, and you can see it and track it. But really my primary instinct was, this stigma is not sitting with me and I need to try and do something. And that was as far as my plan went. And even when I became more involved, I guess my plan was still very simplistic. It was about helping. It was being the voice. And I'll never forget when I was elected onto the board of Lucha, I was just like, huh? What? Me? What? I'm assigned to it? Like, what? Because I guess, in the science field, we're used to talking about imposter syndrome, and we're used to, people calling that out and recognizing it. And I realized then I was going into this advocacy world, and I felt the same way. I was like, oh my goodness, why would they want to talk to me? Who am I getting that email from? And it was all very sort of similar in a sense to some of the issues you would have faced in your day job. And when I became elected as president again, it was just like, huh, me, what? But it was like such a privilege that people were placing their trust in you. That they saw something in you that maybe you didn't see in yourself, that you could lead, that you could change, and you could make a difference. And I think that really helped me, not only in the advocacy space, but also in my day job as well, because, it can be difficult to have that belief in yourself sometimes. And in terms of titles and roles, nowhere in my imagination would I have thought I would have ended up with a title that included the word president in it, because I trained as a scientist. You're in the lab, you're dealing with cells and experiments, and when I became involved in the advocacy space and on the board of Lucha, I was like, I really did not receive any training for this kind of role. So there was a lot of kind of learning on the go, and I'm still learning. I think that's something that you need to be kind to yourself about. We're not going to know everything about everything. It's about being comfortable enough in yourself to say, I'm not sure about this. I need to reach out to someone, and knowing by reaching out and talking to your community, it's not a reflection that you're a failure or there's something wrong. It's just you're learning, and everyone comes with different experiences. And to Lorna's point, I've been incredibly lucky. The people that I've met in the community have been so supportive. And pretty much any time I've come up against something, I've always had someone that I could reach out to. So it may not have been a formal sort of mentor-mentee relationship. It was probably a little bit more ad hoc, but I always knew that I was never on my own. And I think when you know that you're never on your own when it comes to these types of situations, when you find yourself in a leadership position, even if you never reach out to that person or you only reach out to them now and again, I think just that feeling of comfort that you're never going to be on your own can make a big difference. And I know I'm probably talking in much simpler terms than what Lorna has given us. And I guess the challenges that have come is I'm probably in general a bit of a naive person. I just believe the best in everyone. And, going into the advocacy space, after being in academia and research, I made this assumption that we're all on the one page where, there's not going to be any politics, it's going to be all rosy and beautiful and wonderful. And don't get me wrong, there's so many beautiful and rosy times, but definitely seeing that politics are politics, irrespective of where you are, was eye-opening for me and took me back a bit. But I think, as Lorna has said, it's just about trying to navigate that and having all of these different personalities. Even though people are working for the same cause, it can sometimes be a little bit difficult to harness those different personalities. It's not about what they want to achieve, but people might have a different pathway as to how they're going to achieve something. So I've really learned a lot more about listening, understanding, and really bringing people together so that everyone is working towards more of a common goal. But that also has been a challenge and a learning curve for me too.
Wow, Anne-Marie, thank you. Again, with Lorna and I are sitting here smiling and sort of nodding away. So many incredible insights that you've just shared there. So much to explore. What has always struck me about working with you both, you're so humble, and just so again, so passionate about what you do. And we talk a lot about with this, it's about listening, it's about communicating. And I think that's at the heart of what we're doing here in terms of driving healthcare, forward as well, from involving that patient voice, communication being an important aspect as well. Look, you both sort of picked up there around the fact that there's a lot of women working in advocacy, but the imbalance there in terms of the leadership roles. How do you think we can best empower women to progress within advocacy? You mentioned mentorship as well, but look, how can we, for again our listeners here, how can we best empower women into those leadership roles? Lorna, Anne-Marie, I'm going back and forth. Please, either of you jump in.
Well, if you want me to jump in first, I think part of the issue might be that people may see advocacy as like a soft space to be in. And I think in terms, if you were going to say it, there's more females in it than males, I think part of it might come from that, because it is seen maybe as something that's a bit softer. And I definitely know that I've been in conversations that if you're talking about advocacy, they're like, oh yeah, that's lovely. Yeah. I'm just going to tick my box here and say I spoke to you. But then something else might come up and you're like, oh, actually, yeah. And I'm also a cancer researcher. Then they're like, oh. And it still really, really bugs me to this day that, people feel that, advocacy is the softer thing and that you have to come with some sort of background or some sort of title in order for them to take you more seriously within the advocacy space. And that doesn't come down to the person, that just comes down to some people, I think, not really understanding what advocacy is and what you can achieve with good advocacy. But I do think that kind of softer view of advocacy may be one of the reasons we're not seeing as many males. In terms of what Lorna said before about the leadership positions, and I know I'm kind of contradicting myself, but I've also witnessed that even though on the ground, you know, there's so many more females, once you go into those more senior positions, it tends to be males, and you're sort of wondering to yourself, that doesn't make sense. How, like, what am I missing? You know, what meeting did I miss when this was happening? So I think it's probably ensuring that females who want to come in know that they have someone they can talk to, creating that safe space where they can say whatever it is they want to say or ask the stupid questions. And believe me, there's no such thing as a stupid question, actually, but just having that support in that space in which to do that. And then in terms of the more senior roles, I think we need to work more on people formally recognizing the importance of advocacy and what it can do. So then hopefully it would be more an attractive space as well for others to come into it, whether that's males or females. But I definitely think there's a lot of different things we need to tackle around that.
Yeah, I agree with everything that of course that Anne-Marie has just said. Just some things I would add into this. When I'm working with other females, whether they're people on my team or people in our patient organizations, partially, you know, for giving people the confidence to be who they are. You don't have to participate in everything. You don't have to go along with the crowd if it's really not where your heart lies. Then, you know, really think about, is this the space I want to be in? And is this where I want to develop? Should I be with another organization? Should I join a different initiative because it matches more closely with who I am as a person? To really think about that and think those things through. I do think, you know, when you're a female, just from a biological sense, there's a tendency more to be more empathetic, perhaps. You know, I don't want to make any big statements that people are going to argue about, but you know, that empathetic nature will often bring people into this kind of work. But just because you're empathetic doesn't mean that you have to make sure everybody is always on the same page and moving along, you know, and that there's always consensus in everything. You don't. Sometimes there doesn't have to be consensus when you can still have momentum. And so really thinking about what those things are that are important to you, and that when you're at some point putting your stake in the ground and fighting for something, it's for those things that you really focused on, are really important to you, and really conserving your energy and using it for those things, perhaps, than some of those other smaller arguments or issues that might be going on along the way. For me, it's really important. I think for others, you have to learn all the time. The world is changing around us. And so how do you keep your organization and the space that you're working in moving in the right direction to not only reflect what's important to the patients and their family members that you're trying to help, but reflective of the outside world, so that you're participating in the right way. So that's important. And really always remembering you always have a choice, right? When we talk about shared decision-making for patients and we're trying to equip them so that they can have these really good discussions with their healthcare team about the best treatment choices for them and the best care choices for them, take some of those principles and apply them back to yourself. You know, learn about your situation, figure out what is my path forward. Somebody may be saying that this is the right thing for me, but does that really fit with me or not? And so always, you know, even if your choice is yes or no, you always have a choice. So you have to learn to stand up for yourself a little bit. I'm going to be really honest. I'm an introvert by nature, right? So when I think about what ideally I would like to do with my time, I'm quite happy, you know, painting canvases or reading a book. Like, I don't need a lot of people around me. And yet I'm in this environment where there are community is everything. And don't get me wrong, I love it. I love the space that I'm in. But speaking in front of huge crowds, if you'd asked me, when I started in this industry, would I be comfortable presenting to thousands of people? The answer would be, oh my gosh, there is no way. But I had to learn how to do certain things because it was important to what I wanted to do in my professional life. So you have to work through some of those skills that may seem like they're huge and, there's no way I will ever overcome this. But you have to figure out for yourself what those stumbling blocks might be, because they're going to be different. For people that are more extroverted, their issues are probably going to be different than mine. So how do you figure out what is really, again, what's important to you and what you need to do to expand your skills to get there? And I really have to stress something Anne-Marie said. Don't be afraid to ask for help. Like, call somebody up. Somehow I ended up in this role and I don't know how to write a business plan. Find somebody who looks friendly and has said, hey, call me. I'm willing to help, who's been there a little bit longer, and say, how do I do this? Or, and that was, a very administrative kind of thing. But some things, those are practical, that sometimes because of how people enter into advocacy, they don't have those skill sets that they bring with them because they train to do something very different. Don't be afraid to ask. Find somebody who will help.
Absolutely.
Love all of that, Lorna and Marie. And I guess, look, we could talk and we can tell. That's what I love about this. There's so much to keep going. And, we could do many, many episodes around this. But look, let's, think now, final call to action or advice that you've got for, our listeners who may be either wanting to get into patient advocacy, are in patient advocacy, whether that be in patient communities in pharma or, even in education as well. What's your, one piece of advice? I'm limiting it to one. There'd be so much that you want to say, but look, what your one biggest piece of advice you would give to our listeners, Anne-Marie? Start with you.
That is such a tough one. But my one piece of advice, if you have a genuine passion for something, give it a go, try it, because you won't know until you try. And I know this is second piece of advice, so I'm sorry, Victoria.
I'll allow it, don't worry.
But for those that are already within this space, it is okay to say no. You take so much onto your shoulders, I feel, when you go into advocacy, and you feel you should be everything to everyone. And that is just impossible. That is why you need people around you to support you. And you can get overwhelmed, you can get burnout in advocacy, that it is okay to say no. So that's my two pieces of advice.
Wonderful. Thank you, Anne-Marie. Lorna?
And somehow Anne-Marie managed to pick both of what I would rate the highest. So I will say I agree with her wholeheartedly. And the other one is really find your friends. So find those people who are going to support you and uplift you, because it is a challenging space and can be quite a lot and sometimes overwhelming. And so really there are lots of people out there that are willing to support others as they journey along. So find your friends and take advantage, and then be that friend to the next person coming up.
Goodness, thank you, Anne-Marie. Thank you, Lorna, both of you, so much for joining me today. It really was such an insightful, impactful discussion. I'm going away with so many ideas, and just thank you so much to you both.
Thank you, Victoria, for actually inviting me here. It was a great conversation.
It's been fantastic.
And look, I hope everyone listening has enjoyed it as much as I have. We have this conversation, and please stay tuned for the next episode of our Women in Healthcare Leadership series. Thank you to all our listeners. We really do appreciate you tuning in, and wishing you all a fantastic day wherever you are.
Thanks for joining us. Tune in next week as we continue our journey to amplify the voices of women leaders in pharma and medicine. Hear From Her is brought to you by Medscape Education. Please subscribe to Hear From Her on your preferred podcast channel and follow us on LinkedIn. Until next week, remember to lift as you rise.